In this video, we're going to talk about brachioplasty, which is the medical term for an arm lift. And typically we're doing arm lifts for any loose skin and sometimes fat as well, which we may have in the upper arm. Typical patients who get this type of surgery are folks who've lost a lot of weight, typically 30, 50 pounds in that range or more. However, in some people, they just tend to carry all their weight in the upper arms, and it doesn't even matter if they've lost weight or not, they may actually be a very good candidate for an arm lift. Typically, when I'm seeing a patient for surgery, I'm going to evaluate them and see which of the 4 options we have for treating arms can we do, because we always want to do the least invasive thing possible. So first thing we could do is just liposuction. If the patient has just a little bit too much fat and the skin looks like good quality, there's not any loose skin, liposuction is going to give fabulous results. Option number 2 is liposuction with skin tightening. We have some devices now such as BodyTite in my office, which can help shrink down the skin a little bit at the same time as liposuction. These devices aren't perfect, however, so if there is significant loose skin, we're probably going to make an incision to get rid of loose skin. And the first option is a mini arm lift, where we're going to hide that incision up in the axilla. This is pretty unusual. The patients have just the right amount that we're going to be able to get rid of it with that scar. So this is probably the least common one I do. The next option is a full brachioplasty. Most commonly in full brachioplasty, we are making a scar the length of the inner arm, and we're tucking it what we call posterior medially towards the back. In folks who have lost a lot of weight, what we call massive weight loss patients, we may extend that scar to get rid of any extra skin on the chest at the same time, or sometimes even lower down on the arm itself, just depending on where the loose skin is and what the patient's needs are. In the vast majority of cases, I'm going to be using liposuction as part of the procedure. Liposuction is really just a tool in your toolkit, and while we're there, why not tone things as best as possible rather than just getting rid of skin? So typically I'm going to add that in at the time of surgery. Surgery is done under general anesthesia, meaning you're going to be completely asleep for it, you're not going to feel anything, and thankfully it tends not to be a very painful surgery. We never use drains, and we use numbing medication as well to help our patients feel better in the first day or 2 after surgery. Downtime for this surgery is usually about 2 weeks off work or school, depending on what type of work you do, and usually about 6 to 8 weeks of heavy lifting or working out. And we have our patients wear compression as well, especially after liposuction, just to help everything shrink down and avoid the swelling. You won't see your final result for about 6 months after surgery, but you will notice a big difference early on. Scar care is super important, and we're going to teach you the best possible ways to get scars, as well as tuck them posterior medially so that they're more towards the back and they're more difficult to see. Arm lift or brachioplasty tends to be one of the most satisfying procedures I do, and our patients tend to be super happy. It's like they can just put this problem out of their head, where the skin would rub when they would exercise in some cases, or they didn't want to wear spaghetti straps or tank tops. Well, folks can just forget about that and get on with their life. We're seeing a lot of people losing weight now with the new medications such as Ozempic, as well as our bariatric patients, and this tends to be one of the most gratifying surgeries that we do for these patients.